This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle Live. We are here waiting for you on a day that's kind of iffy outside, right? It's supposed to be rain, sunshine, who knows, flip the coin, it'll show up. But nevertheless, it's still an opportunity to get outside, go for a walk, get a little exercise, enjoy the day. But in the meantime, we have a very opportune program for you, one that we talk about kind of indirectly, sometimes very directly, not only on the program, but in the office. And we're going to talk about the impact of emotion on your health and on your wellness quotient, and what happens when, you know, the tiger gets a hold of you and really starts gnawing at your back end, and how the body begins to break down a little bit. But to go back and forth with this, I need somebody who's really expert at it, and somebody who really knows the subject well. And who am I talking about? None other than our naturopathic physician in the Roselle Center for Healing office, Stephanie Pina. Dr. Pina, welcome.
Hello again. The weather is looking a little weird out there, but there are some people walking around, so that's good.
It is. We got out yesterday. I went for a ride, and I went out to a friend's house and picked up a couple of things, but it was a perfect day. Then all of a sudden, the clouds opened up and the rain hit, and you really couldn't even see in front of you. It was coming down so heavily. And I was out in the western suburbs, out in the Ashburn area, but it was just unbelievable. I hate to think what would happen if this was snow. I mean, we'd be buried in like for 10 years. Now, having said that, we're talking about emotional impact, anxiety, depressions, thought processes, all those things, and how they have an impact on immunological responses, if you will. Emotion has an impact on your health. So we've gone through several months now of anxiety. We have adults and children are in a state of depression. I don't think there's any of us that it hasn't hit. Even the first line defenders, if you will, the heroes as they're putting out there, the people who are dealing with all of this, and some of it is real, and some of it is the hyperbole, if you will, of buying into a scenario that could be right and some of it could be wrong. And I want to discuss it, and love to discuss it with our listeners today. And all they need to do is call us at 888-630-9625, and we'll take those phone calls and discuss the topic. But let's get into it a little bit, and let's start with something very basic. What does emotion have to do with someone's health and reception, if you will, of incoming bacteria, viral patterns, and pathogens that ultimately end up in something called sickness?
Well, we know overall it tends to not make a really good impact, but at the same time, it's something that we can change probably easier than the outside environment and quicker than we can change the inside environment as well, too. We know that, as you're saying, anxiety, fear, depression is rampant all the time now, especially since March and February. But essentially what's also happening is, and I like to discuss too, is the fact that it's been going on the whole time. Like we've always tend to put our emotions aside, even for our physical health. And so when we see patients come into the office or we get asked questions about how do we address mental health issues, different types of emotions, and how does that correlate with physical health, we know that it slows down chronic healing processes. Chronic pain tends to be worse. If we don't have the support systems in place and different people we can work with, and even different types of therapies, we know that that can lead to more and more issues. It gets deeper, and a lot of times people even have trouble expressing what they're feeling to begin with, so they don't even have a diagnosis or an idea of where to start. So really opening up the conversation with a lecture webinar like this is a good place for people to start with, because they do know that they're not alone out there, and that there is consequences that they're probably not figuring, that their emotions are affecting their physical health, and immune health being one of them. Here we are trying to protect ourselves and our immune system from the COVID virus and everything else that's going on. But essentially, when you think about it, no one's really looking at the emotional side of it. So this is a great opportunity to kind of dive into that. But then what do we do when, we have normal issues, normal stressors that trigger our emotional impact as well?
Well, the thing that I want to get into as well is, and people need to understand, our listeners need to really appreciate, is that emotions can be positive, emotions can be negative. Emotions can be supportive and healing. Emotions can be in a very subtle but continuous suppressive way, knocking out our immunological responses, and subsequently we become more predisposed, if you will, to all kinds of things that take place. I've had years of being able to follow and treat and learn from some of the masters when it comes to how the mind-body connection works. And that's really what we're talking about. In our practice, we talk about three things that cause anything: either injury to the nervous system, biochemical, bioelectrical insult, all the things that are around us, exogenous, if you would. And the third piece is the emotional piece, and that's how the mind works, or the mind interprets and adapts and, puts upon our system. The body can heal virtually anything, but can also destroy anything. And that's where we have to be very, very careful. The words that we use, the thought process that we agree to, the applications based on things that are outside of us. And, we have to take that through. But here's the beginning consideration. Take us through that emotion and immune system response relative to a basic scenario. We're afraid of something. We are constantly in a state of perceptive jeopardy. And what happens to our body's immunological responses? Why does that have such a powerful impact?
Sure. And the good thing about this is that it's something that's built into our system to actually help us, to keep us alive. Because when you were mentioning the tiger running after us, it was a survival mechanism. But when it gets overblown in one way or the other, then you can only survive by changing off where your energy is spent. Is it spent running away from the tiger or defending from illness? So one of the easiest things to think of is our nervous system is broken up into the autonomic system that essentially has this sympathetic system, which is our fight, fright, and freeze system, and then our parasympathetic system, our rest, digest, and reproduce system. And essentially, when we have that stressor, no matter what it is, and even if it's in our mind as a stressor, which is a good point to bring up, it doesn't have to always be physically in front of us. It's that fear of the unknown, and couldn't be even more so of what's going on right now. Our body's going to respond without us having to think about it. And so if we're in that fight-flight mode, which is basically getting us ready to run from the tiger, to respond and fight, or to freeze in place, basically, we have to basically decrease some of our other systems. So our immune system goes down. We're trying to get all the blood circulation to our muscles, to our heart, to our lungs to breathe. So what happens is that the systems that are in place that take time, like our rest digest system, they need more time to relax. So essentially what's happening is that the immune system needs to decrease in order to get the blood flow where it needs to go. And so we have to sacrifice our basic functions. And so sometimes things like digestion also kind of become an issue. And you see that more and more people with chronic stress may have digestive issues. They may have difficulty processing things, sleep issues as well too. So all of those issues, digestion and sleep, are part of the immune system. We can't just let one system go down in order to save the other.
In today's world, particularly over the last many months, you hear people talk about hopelessness, despair, rejection, sadness, depression, anxiety. The list goes on like crazy. And, we've developed a state of pessimism, not only in environment, but also for ourselves. And even today, though we're starting to open up, the fear pattern has run so deep with people that they still won't step out. And it's unfortunate because when we get into our short segment, the one after this, I'm going to talk a little bit about an article that was just released, and I'll spend a couple of minutes on that and kind of put a few things in perspective. But, when you have that ongoing negative response, your immune system suffers. There was, a guy that I like to quote, Leo Biscaglia, back in, the day, Dr. Biscaglia is gone. He was, they call him the love professor at Berkeley years ago. And, he talked about how, happiness and embracing people and hugging them and just a little peck on the cheek increased the red blood supply, increased white blood cell production in the body to defend you. So if that's true, then conversely, the alternative is true as well. When we don't touch, when we don't have socialization, when we don't engage with each other, when we're fearful of everything that's around us, the immune system gets kicked in the pants, and now we become much more exposed, if you will, to everything else. There was an interesting article that was online the other day that I saw, and it was a doctor that was trying to pictorially represent what happens with immune environmental situations. So he had a fish in a fishbowl and another fish in another fishbowl. And one fishbowl was dirty and the other fishbowl was nice and clean and so forth. And the dirty fishbowl, where the fish was sick and the fish was breaking down, the caption was, "Let's vaccinate the fish." And the other one, where the fish was vibrant and healthy and a very clean, clear running water, it simply said, let's support the environment. So those are the things that we relate to ourselves. We have an emotional environment, if you will, that is perceptive relative to our body's physiology. So, what happens when you have a mindset, if you will, that says, oh my God, I'm going to die. I'm going to get whatever it is out there. And does it make it more so, or does it make it less so?
Well, it could go either way, but one of the main things to think of there is if that's your mindset, certainly the things you do in the world around you is going to change as well too, because you're basically living for that moment of death. So are you going to be as excited about going for that walk? Are you going to be as excited about meeting people? Are you going to probably pick the best foods? No, you're going to pick the comfort foods, and you're going to say, what's my last meal? What would I want it to be? So when we think about something like that, we have to think about how difficult it can be for some people to completely turn that around, but they do need someone to help support them to realize that that's going on there, because we might be doing that unconsciously too. I mean, I was looking earlier today, and unfortunately there was a new term that they might put into the Webster's dictionary thanks to everything that's going on, called doom surfing. And this is when we stay up late on the internet and look for information about everything that's going on between the virus and the protesting and everything that's going on. And so that people are having physiological reactions and they're not sleeping anymore. They're waking up with that fear and panic and anxiety. And we see that in the office, as you mentioned. People that we talk to and we check in on are constantly kind of coming in. But you start to see physiological changes that definitely start to add up. And it seems like one little thing, but if your diet's been off for a little bit, and we know how quickly that can catch up with us. I always tell all my patients when they come in, especially for acupuncture, there's 3 basic things we always start by treating, and it's your immune system, your adrenal health, which helps you deal with these stressors, and the mental emotional part. And after that, we start working on your individual stuff, because where we are now that's the baseline for everybody. If we don't support that, we don't have anything else to support after it.
You talk about things like failure and helplessness and hopelessness, if you will, and there are different systems that affects and grief, and they all have an impact. And we want to talk a little bit more about that specifically as we come up in the second part of the program. This is a program we can talk about actually for hours, but nevertheless, my guest in studio, Dr. Stephanie Pina, we're talking about your emotions and the impact it has on your health. Don't go away. You're listening to Dr. Tom Roselle Live. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, we are bringing you a very interesting program, one on the impact of your emotions on your immune system. what a better time to discuss something like that, and what a better person to discuss it with me than Dr. Stephanie Pina, our naturopathic physician at the Roselle Center for Healing. And we're talking about different pieces of the puzzle, but what all of us know is true, even on an innate level, is that when you're positive and you're solid and you look at things as moving forward to and what you can do to increase the strength and capacity and vitality, that's usually what happens. When you're in a state of fear and trepidation and you're looking at everything as a monster that's going to eat you, your body begins to degrade and break down and destroy itself. I promised you that I was going to give you a little piece of data that came out. Some of you may be very much aware of it. Some of you may not. But a couple of days ago, on May the 26th, there was a report that was released by the CDC, or the Centers for Disease Control, and this one is legitimate. It's been fact-checked, and it says the CDC confirms extremely low COVID-19 death rate. And a lot of you are going to say, what? That's not what they've been talking about. And the reason I'm bringing this up is because the emotional impact that it has on our health overall. So the article starts out and simply says the CDC now independently confirms recent research study by the Stanford University that COVID-19 has an extremely low death rate. So this goes to a place where it's exposing, and we're going to use the term technocrat hysteria as being man-made and not based on anything real, and the information is verified. So when we go through things like we've gone through over the last many months, and we see the up and down and emotional cascade that's taking place, and what we're talking about today is the impact. And I want you all to go to the CDC site, and I want you to fact check this yourself, because I've done it in a couple different ways, because a lot of the things I even go into their site, I begin to question. You're going to see something that flies in the face of everything else that we've been told. And, you're hearing that the cases are going up. Well, the more that you check any viral load across the board, the more you're going to find that there's an increased exposure. For example, there's a virus out there that has to do with mononucleosis, Epstein-Barr is the name of it, and so forth. There's a chronic fatigue virus that there are estimates that says that anybody that is over the age of 21 has been exposed to it in this country at one point, and you're going to have an antibody that's going to say, yeah, this person had it. So check it out. But, we were told that the death rate was 3.4%. That was an estimate of the World Health Organization. So now the CDC, which everybody's hanging their hat on, comes in and says, not so, that the overall death rate, get this, the overall death rate, according to the CDC, is 0.004. That's crazy. That flies in the face of everything anybody has said up until now. Check it out yourself. I want you to go in and check this data out. My job is to provoke you to do your research, and particularly in this particular situation. What are we talking about? We're talking about emotions. Dr. Pina, let's put this in its perspective. We've been suffering under this heavy pall, if you will, for several months now. And have we been more affected by the anxiety patterns that have affected our health, or this crazy coronavirus that's out there? We have kids that are committing suicide, adults the same thing. We have domestic abuses. We have people's immunological systems that are suffering. We have people that are dying of heart attacks. Is this all because of COVID, or is this what we're talking about, this anxiety-ridden situation, this environment that seems to be unfolding in front of us?
Well, the whole time tends to really make it a perfect storm, because then you add in more recent things that have happened in the last couple of weeks too. And so all of a sudden now you have, do I go out, do I not go out, and a lot of fear and stuff related on what's going to happen when I go outside, what happens when I go to check up with my doctors, the ones that are supposed to protect me as well too. So that fear of the unknown, and whether that has to do with the current situation or even other life experiences in general, tends to kind of get us in that state of kind of trust and just fear until we feel more comfortable with the situation. And that's probably not going to go away anytime soon. And one of the interesting things that I've seen in some of the research is that mental health experts that are looking at this current situation, and even one that I saw a webinar back in early March when we were talking mostly about how social distancing was going to work. One of the interesting things that he was saying is, when we look at in the past and we see what happened, say, post 9/11, there was a small area of people, and as you got further away from New York, the post-traumatic stress got less and less. But he's seeing that happen now everywhere. It's something, because we're all affected. There is no local area. So it's definitely something that's going to affect us going forward as well, too.
Well, we're going to come back on that topic because there's a lot more that I want to bring out to people's attention, but it's an important consideration. We're coming up to the break. You're listening to Dr. Tom Roselle Live. My guest in studio, Dr. Stephanie Pina, will give you the information how to access this data after we come back. Don't go away. We'll be back in a moment.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We are indeed live, as we are every Sunday. My guest today, Dr. Stephanie Pina, naturopathic physician at the Roselle Center for Healing, and we're talking about all the emotional upheaval that can cause your immune system to break down and become much more susceptible to virtually everything that's around you. If you'd like to talk to us here, all you have to do is call 888-630-9625, 888-630-9625. Happy to take your calls. If you even have a comment on what we're talking about, that's wonderful and will be received as well. Dr. Pina is going to be presenting a PowerPoint on the subject of immunological responses as it relates to stress patterns. And all you have to do to register for that is go to rosellecare.com. That's ROSELLECARE, rosellecare.com. And you'll go to register here and you'll put your email address in and they will send it to you. So it's an easy way to make it happen. We're really looking forward to getting our classes back into the office, and we'll be doing that pretty quickly with Virginia opening up better than it's been in a while. So we'll let you know. We'll keep you informed. However, having said that, Dr. Pina, welcome back. This is a topic that everybody gives lip service to, if you will, that the immune system is very receptive to emotional platforms, if you will. What we think is actually will show up in our bodies. And, you can talk about all kinds of immunological response. We've talked about, and I've done this personally with a guy by the name of Tony Robbins, where his keynote experience, the first day of a 4-day program, is called Fear and Power, the Firewalk experience. And you have, at the end of 4.5, 5 hours, you're standing there with 3,000 of your closest friends, and you have your shoes and socks off, and you're walking across a 2,000-degree hot burning bed of coals, and nothing happens. That's immunological response. That's the mind over the physiology of the body, allowing somebody to be able to do that. We're talking about the very same thing. We're talking about the mind's control, but we're talking about the impact of how we interpret information, and particularly in today's environment, the depression, the anxiety, the thoughts of loss and having no hope moving forward. So let's jump back into that and let's talk about that responsive pattern relative to the formation of disease, if you will, and how the body begins to break down. Heart disease, diabetes, all types of other types of immunological situations.
Yeah, they do have some interesting, it's interesting that you bring up diabetes because there are some interesting studies after certain major traumas in the world where they tracked different types of health because they realized that mental health has a lot to do with physiological health. And we wouldn't think something that has to do with blood sugar handling would have to do with it, but you got to remember the fact that the rest of the body, the circulatory system, the neurovascular system, has a lot to do with how we're dealing with these stressors, and blood sugar handling can be one of those. So there's been a rise in diabetes. At the same time, too, when we think about the doom and gloom part of this, the things that we do to help patients and people kind of connect with their own emotions, is invaluable. Like, it really needs to be there, and it's complex as well, too. So there's never one particular way that kind of serves one person the best. It's kind of diving in there and finding how to make treatments individualized for them, to making sure they are able to express their emotions and how things might change just as the environment outside of them changes. And the great thing with something like Chinese medicine and homeopathy and some of the more holistic types of medicines that we practice is that it has to look at the whole person. It's the totality of it. So it's not just a mental illness or a mental emotional disease that we're dealing with. We have to treat the whole body. So as you're dealing with someone coming in with stress and frustration about what's going on, we're looking for those physical aspects of it too that they might be totally ignoring or saying, well, that's just normally me. I normally get tight muscles. I normally have a racing heartbeat. I can't sleep at night. And so we have to look at the whole body and how their body is particularly responding to these types of stressors in order to create the best treatment plan for them and educate them otherwise.
There's an interesting situation that I've observed over the last few months in seeing patients in the office. People come in and they're basically, I'm going to use the word grief because it's what the point I want to bring out. They're grieving over the loss of their freedom. They're grieving over the loss of their capacity to do things. They're grieving over, the loss of the world and life as they know it. And we know that in natural medicine and Eastern medicine that grief has to do with the lungs. So now they start showing up with a little wheezing, and they start showing up with a little bit of a asthmatic pattern, or they feel that their chest is tightening, and they go, oh my God, I must have COVID, because that's the symptoms of COVID. But what's happening is the immune system is now affecting that organ system, because that is the organ system of unresolved grief. How much of that are we going to see because in other conditions, because of what's going on in the interpretation of the environment?
You're going to see a lot of it. And I think, like you were saying, some of the symptoms that people come in for are going to seem pretty vague. They're going to know that something's just not right with them. It hasn't been right for a while. And everything that they've kind of done and tried in the past probably isn't going to work because it can't be treated the way it was before. We're not in the same position we were before. We didn't take into account the environment around us. We've changed seasons. We've gone through almost half a year now. So everything around us is very, very different. And even when we look at our normal job stress, those of us who worked through that time probably had an easier time because we basically had some kind of everyday schedule that goes back and forth. We got used to getting up at a certain time and eating at a certain time and sleeping at a certain time. I remember, I guess it was about a year ago, maybe, when the government shut down and they were shut down for 3 weeks and we had patients still coming in. And during that third week is when all of a sudden everything went haywire. No one was sleeping. Everybody was frustrated. They didn't have a schedule anymore. So as we even start to get back into getting out into the world again, we don't have that schedule built in. We're dealing with some of the same stressors. How do I get my normal food in when I'm fearful to go grocery shopping or to a restaurant? So it's a little bit different because we have to deal with not only any physical stressors that may have been diagnosed or not diagnosed, but the things that we don't know about and the things that, are still left unseen. The unknown is a very fearful place. So we have to make it less fearful. And we've done that in the office by trying to tell patients, say, what to expect when they come in. But until they actually come in, until they've actually kind of walked through the waiting room, through the pre-screening and gone in and gotten their treatment that they needed for so long ago that they haven't had for a couple months, they start to feel better. Now, is it because they finally realize that they can go to a place of healing that they enjoy and they miss, or they also got the treatment too? So there's a lot of different aspects of what's going on, which makes this particular situation a very unique one compared to anything we've seen in the past. And it's really tough when people start to compare it to, say, the Spanish flu of 1918, because we weren't in the same spot that we were then.
No.
So we really have to address where everybody is currently, and then also look at the different types of things like their job career stressors that they had before. And I have a whole section on talking about teachers' health, and that is completely changed depending on what just happened in the last 3 months.
Now, I want to remind you that Dr. Pina is going to be doing an online presentation this Wednesday evening, and you can have that sent to you. You can watch it in the privacy of your own home. You can share it as you can many of our presentations over the last several months. All you have to do is go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com, and scroll down, be about halfway down the first page, and it'll say register here, and it's about the emotional side of healing. Hit that, you'll put in your email, we'll send it to you. Feel free to share it. all of our past presentations, by the way, are available, as our radio programs are as well. So you can follow the links to the website. So rosellecare.com, and you'll be able to register for this Wednesday evening's presentation. Dr. Pina, let's get back into talking a little bit about the immunological response and how, we know that people are fearful with all this. And I mean, really fearful. You see people that will step across the street if you're walking towards them and you don't have a mask on. And, they're gloved and they're masked and they have N95s on and so forth. And still that fear pattern goes deep to the core. What does that fear pattern do immunologically? What does that emotion of fear do relative to things that will happen to that person over a period of time, if you can stretch it to that level?
Well, I talked a little bit at the beginning of the show where, our sympathetic response, that fight-flight response, has a lot of different impacts on the body. And one of it, if we had to run from that person that we were afraid of, is to increase our breathing pattern and get our heart rate going so we get more oxygen through the rest of the body. Unfortunately, when you see someone who's wearing and they're exercising or they're even walking and they have a mask on too, you already have a restriction of oxygen anyway. So now your body has to work that much harder to function normally. And in doing that, it kind of has to revert that blood flow from other places too. So it actually ends up fatiguing us a lot quicker as well. I don't know anyone else that else has done a lot of Zoom meetings and calls as well too, realize that there's like Zoom fatigue. You don't even have to go outside. You can put the mask on inside on your Zoom meetings and still have the same response. You don't have to be outside. So there's a lot of different things and everyone's a little bit different. They're going to find the weak spots. That's what I'm seeing, is that people are coming in their weak spot, whether it was digestive or anxiety or even structural. When we talk about the biochemical, mental, and structural, it's going after their weak spot, because really that's where we need to help to focus on it. And they may not be as familiar with dealing with the emotional side of it. I wanted to say real quick, when we put the presentation out, because when we deal with emotional issues, it's not one that when we have people in the office and we're doing this in person, not everybody wants to raise their hand and ask a question and kind of point themselves out saying, yes, I'm that person with anxiety and I have an issue with this, or I want to send a different opinion out to the world. So I put my personal HIPAA secure email on the first page and a number of pages, the first and the last in particular, so that way patients and people can reach out and ask that question that maybe they don't get a chance to do, and they definitely don't get a chance to do during a webinar presentation versus when we do in-house. So hopefully people realize that when they're out in the community, that one, it is creating more psychological stress. And so we have to find a safe, healthy space for them to kind of help themselves, but also to help deal with the current time and be able to know that you're going to get through this.
Well, we got a couple minutes and then we have to take a short break. But let's begin to talk a little bit. What's the fix? How can people support their immunological responses? I know you're going to cover that in depth in your presentation, but if we wanted to give some direction right now, what would we tell people to do?
Well, one of the main things, no matter what the emotion is or what the situation is really, you kind of look to see what has helped other people in particular. And it can be, a treatment has to be individualized for the person. What works for one person isn't going to work for another person. So I tell people always focus on what's that thing that makes you feel really good? What is your go-to thing? If you had all the free time in the world and you didn't have any restrictions on where you could go, what would be that thing that you would do? Would it be listen to music? Would it be to journal? Would it to be watch a movie? All of those things. And even when we get involved with social activities like charity events and raising animals and getting outside and gardening, we're getting ourselves out of our head. And that's the biggest key, is we have to find something to basically self-occupy our own minds. So we're not constantly dwelling and thinking about things over and over and over again. So everyone, the person who doesn't like to go out in the garden, you can't force them to go out in the garden. The person who doesn't want to meditate and pray, it's going to drive them even more crazy. I've seen plenty of people go to a Qigong class or a Tai Chi class and go, it's so slow, I can't do this, I'm boring myself. We have to find the right thing for them. But what I say is start with that list of things that says, this is what I could do and what makes me feel good, and kind of just gives me that downtime or that me time that we used to be able to mix. Because as things start to open up outside, we're going to be able to get out a little bit more and make some of that stuff happen. but what do we do at the current moment? What we do in the office too is we give them that healing space that they need, so they get that 20 to 25 minutes to just kind of relax and be themselves, and they're the only one in the room, and that might be the only time they get 2 seconds to themselves.
I know, it's important, and you know, people have to take advantage of it. Get out, don't be afraid. Get out and stretch, breathe, take those silly masks off when you're by yourself, and get some air into your body and breathe deeply. Don't breathe in your chest, breathe all the way through your abdomen. You know, I've taught patients for years, walk 2 miles every day. It doesn't make any difference how fast you walk, but if you breathe and walk, you'll increase your immunological response and things will be far better than it is right now. We're coming up to a break. My guest today, Dr. Stephanie Pina. You're listening to Dr. Tom Roselle Live. Don't go away. We'll be right back after some important messages.
Washington's Mall, 105.9 FM, WMAL.
Welcome back, everybody. Dr. Tom Roselle here. My guest in studio, Dr. Stephanie Pina. We're talking about the emotional impact on your health and your well-being. You listen to Dr. Tom Roselle Live every Sunday, 11 a.m. on the Eastern Seaboard. Those of you who are around the world that listen to us and online, thank you. I appreciate that. Let everybody know that we're here and we're trying to bring you the most important information and to provoke you so you do your own homework. Remember, I've said many times, you know, I don't want you to believe me or anybody else 100%. I want to be able to stimulate you, provoke you, if you will, so you can do your homework and check it. You know, what's the word they use today? Fact check. So fact check everything that's out there. But I think you'll find that the information that we're giving you is going to bleed true in many different ways. So do the data, do the fact check, and see what's there. We're talking about the emotional impact, if you will, on immunological function and why people are getting sick. And it's not because of COVID. It's because of the fear patterns. It's because of the grief of loss of a way of life. It's all those things building up until now. And by the way, if you want to get a hold of Dr. Pina offline, it's real simple. All you have to do is go to rosellecare.com, 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 and send her a note. She's online there. It's a secure website. Or simply call the office at 703-698-7117 and tell the staff that you would like to speak with her, and she'll get back to you. The other piece is you are able to get this webinar that she's going to be putting out. All you have to do, again, go to rosellecare.com and register for it. We'll send it to you by Wednesday, and you'll have all this information that we're talking about today. Dr. Pina, let's wrap it up just a little bit and talk about what actually, you know, people would gain by going and asking for the webinar and having it sent to them, and also getting a hold of you and, you know, having you help them, assist them in this crazy time that we find ourselves in with all these emotional upheavals, is up and down, and, you know, putting us in a place that we're depressed, we're, you know, we don't know what to do with our lives.
Well, the good thing is that we're going to cover, you know, how emotions affect health and healing in the body on a lot of different ways. And so it's not just the emotions in COVID webinar, because we get enough of that. So what we want to do is make sure that we understand how it affects our regular health, because when we have to look at this, we have to look at other disease processes as well too, and kind of understand how is this coming about. So when we understand emotions better and their physiological changes that they create in the body, we can understand how to make changes better. And that starts from the basic change that can happen within an hour to something that's going to happen over time. And that can also be part of a treatment plan instead of the only thing. So some people, if they come in and they have questions on, you know, is my medication going to interfere with my acupuncture, or what's going to go on, we have to address that individually. But we also have to see how's our normal day response, our stress response, dealing with things, so creating impacts. So this webinar really is there to look at how emotions affect the body, to discuss some of the things that, you know, we see that are prevalent, that says if we don't address emotional health in an everyday basis and during a normal time period, how this can lead to more physiological changes, and then give you some ideas of some different ways to thinking about individualizing a treatment plan for you, and whether that takes into consideration holistic medicine, mind-body medicine, diet, nutrition. How do we create the plan? What's our thought as we're talking to people as well too, and our experiences that we've seen? Because like I said before, right now it's about treating the immune system, the adrenal system, and about that mental, emotional health. You can't leave a piece of that out, but there's so much more with it. And that's why I also want to say sending out the email and knowing that you have the ability to contact not only myself, but one of the other doctors at the office, especially if there's another issue going on or a physical issue, is good, because people didn't know who to contact when they couldn't go outside the door. We're only a phone call and an email away. So no matter on all those issues, that we're there for them. We're there for them during this time and even after, when we have normal times again as well too.
Hopefully we'll see normal times again, and soon, more than later on down the pike. This is an important time. It's an important time that people have the tools to reformat their lives, to be able to understand that they really still have control and not react. I tell everybody the number one thing that we all have to do is stop watching all the talking heads. Whatever your poison is, whether it's Fox News or CNN, get off the television screen. Maybe allow yourself one news cycle a week. You'll catch up. There'll be the same news on Friday that it was a week ago Friday. And so if you do that, you'll find that things will be calming down. Begin to imbue things that are very supportive and that are uplifting. I'm online all the time. I listen to guys like Dr. Joe Dispenza and folks of that nature to get my headspace back to where it needs to be and to be able to move forward, because we all have to support each other through this situation, and not said, oh my God, let's just hold hands and walk off the cliff, but what can we do to really uplift our immunological responses, our physical capacities, our ability to move forward and create. That's really, truly what's important. And if we do that, together and get back to realizing that this country has and the world has some amazing opportunities and amazing people, that we can begin to develop a future that will come out of in a way that will be so strong, so viable. But the problem is that we have now been put into a cave, if you will, and we've got to break out of that cave. We've got to get outside. This is an exciting presentation. We could talk about the individual physiological aspects of this ongoing and probably be here for 3-4 hours. But join Dr. Pina online. Go to rosellecare.com, register for the program. And remember, we do this program for one very specific reason. We love you all. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.